Thanks, Doctor and Dr. Ajay. What a beautiful day. Great weather in Maryland today. Welcome. Welcome to Medical Mondays with Dr. O. Earlier this month, we talked about the fact that February is a special month, though it has 28 days, and of course, some years 29 days, but this year 28 days, it features many different aspects of life. It is Black History Month. It is Pediatric Dental Month, I think it is, and Cardiac Month, that is the Heart Health Month. And we decided that we were going to touch on every aspect of what we've agreed that February exemplifies. So, without much ado, I am Dr. Tony Okwesami. I'm a physician in Maryland. I am in family practice, and I enjoy learning, teaching, and just coming together once a week to further discuss our health and how to prevent disease entities. Today, we purposed to talk about Black history. Our speaker was supposed to be Dr. Nelson Aluya, but he called me a few hours ago that he had a conflict. And I'm so thankful to my brother, my friend, Dr. Ajagbe, who agreed readily to step in. And thank God we've been talking about this since last month. And so he made it somewhat easy to get into this topic in the short time we have to discuss Black history, the people who have contributed into medicine as Black people, and also to discuss preventive medicine, and of course, again, the pioneers and their legacy. And Dr. Jagbe will be our main speaker tonight. I'll be here for support. And so, Dr. Jagbe, the floor is yours.
Yes, it's another beautiful Monday evening. Thank you, everyone, for coming, and hopefully, we will be able to take a journey through the history of America, and particularly pay attention to the Black history as relates to the evolution of medicine and the participation of African Americans, AKA Black Americans, even despite the segregation and slavery and all of that. There have been many pioneers in the evolution of medicine in the United States of America. So what we are going to do today is to highlight a few of them that are really at the top of the uh, discovery of medicine in America, and to honor their contributions to medical profession, particularly to preventive medicine. So let's just go through this quickly. I have a few slides. They're not very many, but they're just to prompt us as to remember those people who are trailblazers in the evolution of medicine and healthcare in the United States of America. So, from historical trailblazers to modern innovators, their contributions that shape the healthcare today, we will highlight some of those that are very prominent in the history as we review them. We will explore their achievements, particularly the pioneers, despite the segregation and all the oppression that were going on at that time. They were still able to uh, impact, the development of the medical sciences, as well as innovation that are driving medicine even up to this present moment. So, since we are focusing primarily on preventive medicine, we will try to kind of give a quick definition. Preventive medicine focuses on promoting health and preventing diseases before it occurs, preventing disease before it occurs. It involves screening, vaccination, health education, and lifestyle interventions. Black pioneers have significantly advanced these approaches in patient care and public health. As we will see, you will, if you, as we follow the historical accounts, we will see that these men and women were very, very prominent, and not just being very intelligent people, but the fact that they were able to navigate the terrain of oppression and slavery at that time to be able to actually bring about changes that will affect not just the blacks, but everyone, every citizen of America, and in fact, across the world, because there is nowhere we talk about medicine without, in the world, that we won't refer to all the developments that originated from the United States of America. So the first pioneer that we're going to talk about and his contribution is Dr. James McCune Smith. He lived between 1813 and 1865. He was actually the first black physician in the United States of America. He used statistics to promote health equity. So if we are talking about disparity in the current medical arena, it is not new. This is the guy that started everything about showing inequity in terms of the access to care as it relates to minority, particularly the African Americans, in the 1800s. Can you imagine? So that's a real trailblazer who use statistics to the utmost, in the sense that without numbers, it is easy for politicians to say, we don't see any problem among the blacks. But having statistics, and I know Dr. Aluya and a few other on this platform have always talked about numbers, 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 numbers. So statistics cannot be ignored. So this man, Dr. James McCune Smith, was really a trailblazer, and has really enlightened us and showed us that statistics can truly be used as a tool to promote health equity across board. The next person is Dr. Rebecca Lee Crumpler, who lived between the 1831 and 1895. She was the first Black woman to earn an MD degree. She emphasized disease prevention in maternal and child health. So she was a real pioneer. I'm sure for some of us who might have been following the history of oppression and segregation in America will have heard of the atrocities that were performed on African women, African American women, during the slavery, that many things were done on them as regards pregnancy and, uh, you know, uh, around pregnancy, all of the surgeries and interventions that needed were done without anesthesia on many of them. Well, I wasn't there, so I wouldn't know the accuracy of it. But those are the kind of things that we heard. But to have somebody like Dr. Rebecca Lee Crumpler championing, the disease prevention in mothers and children at that time was a big impact. And I think we cannot talk about the maternal and child health in the current context without really feeling the weight of the impact that Dr. Rebecca Lee Crumpler had on medical and healthcare delivery system. The next person is Dr. Daniel Hale Williams, who lived in between 1856 and 1931. Uh, Open heart surgery, pioneer. He was the one that advocated for hospital hygiene and post-operative care. If you knew how many of the surgeries were done, some of them were done very crudely in the past, with people just taking shots of, alcohol to anesthetize them, or in combination with chloroform and all of that. But many things were still not done in a very standardized way at that time. So to have Dr. Williams at that time performing open heart surgery, that's number one, and then insisting on asepsis, that is to make sure that there is no way infection will spread from providers to the patients as well as from patients to the provider. And that is a very great impact that one single person could have on the development and evolution of medicine. Dr. Charles Drew, and I'm sure many of us probably know there's a medical school named after him in California. Dr. Charles Drew lived between 1904 and 1950. He revolutionized blood banking and transfusion. If we don't remember anything tonight, anyone who has had a relative who has received blood transfusion ever in this world should give thanks, in retrospect to Dr. Charles Drew, because he revolutionized the blood banking to make sure that blood safety was paramount at that time and is still paramount right now. So that the refrigeration and the ability to reuse blood uh, to keeping the integrity of the blood cells was, pioneered by Dr. Charles Drew. So we owe so much to these pioneers, and we cannot rave about them enough as regards their race. They are African Americans, and despite all of the obstacles that were in their way, they were still able to bring transformation to the healthcare system. There are other people who were more current, more recent than the pioneers. Uh, the recent contributors and innovators are this. And the first one is Dr. Regina Benjamin. I think she was born in 1956. Um, she was the first. I'm trying to hesitate here because I can't remember if she was the first black or the first female Surgeon General in the United States. But this woman was the one that championed the prevention strategy, the national prevention strategy, as a Surgeon General to the United States of America. Dr. Marilyn Hughes Gaston, in 1939, advanced sickle cell disease screening and prevention. So these are people who are much recent compared to the pioneers that have really impacted medicine. Dr. Jocelyn Elders, I'm sure you remember her name. She was very recent, and she was the Surgeon General that emphasized the promotion of preventive health education and wellness program. That was her pet peeve at that time when she was the Surgeon General. David Sacher, I'm sure many of us remember him. If we don't remember Dr. David Sacher, he was the one that actually, as a Surgeon General, that brought to the limelight the First of all, the disparity issues, just like the pioneer that did that with statistics, he also was the one that actually brought to the forefront the connection between oral diseases and cardiac diseases. If you read the Surgeon General report that he championed, you will see that it was the very first time that a Surgeon General actually brought oral health as close to every other aspect of medicine, uh, compared to any other Surgeon General that have ever been. And since then, nobody has emphasized on the correlation between oral diseases and cardiac problems. So, um, these are notable inventors and their impact. Dr. Vivian Thomas, who lived between 1910 and 1985, developed surgical techniques for um, congenital heart defects, that is the blue baby syndrome. So you can see the blue baby syndrome. I'm sure I'm not going to go into the details of that, but just to know that there are some babies because of heart defects, congenital heart defects. They seem to have kind of communication between the right and the left side of the heart, and so they always look blue as though they do not have enough oxygen circulating in their body. But anyway, so this um, pioneer, even though more recent, Dr. Vivian Thomas was the one that developed the surgical technique for congenital heart defect repair. Dr. Williams Augustus Hinton, between 1883 and 1959, created the Hinton test for syphilis, advancing the early detection of syphilis. Dr. Patricia Bath, she invented the laser phaco probe for cataract treatment. That's in ophthalmology, preventing blindness. Dr. Samuel L. Kuntz, um, between 1930 and 1981, pioneered kidney transplantation and monitoring to prevent rejection. So, how did all of these pioneers and current or recent, you know, um, juggernauts in medicine, how do they impact or public health and prevention? Well, as you can see in the bullets, they everything put together was promoting routine screening for early disease detection. They were advocating for vaccination, immunization, and program. Advocating for vaccination and immunization programs. They were addressing health disparities through community health initiatives and statistics. We've seen that. And they were also improving maternal and child health outcomes through education and care. So, when we talk about history, we cannot just talk about the past. We will talk about the present and the future. So, how do we tie this together in that regard? Advancing the medical profession cannot occur cannot occur without bringing to bear what happened in the past and expanding and leveraging the past to get a better future. So, expanding access to healthcare in underserved communities has been like a mantra. We hear it almost everywhere that we go to, but we still have some kind of health disparities. But it's improving, I guess, on an ongoing basis. So, innovating surgical techniques and post-operative preventive care, that's also been improved upon because a lot of things have been brought into healthcare system to improve surgical outcomes so that people don't die from complications that surrounds surgery and other kind of techniques that have been applied in to improve health in patients. Developing medical devices for early diagnosis and treatment. These are constantly ongoing. I'm sure one of the new devices that seems to be uh, very revolutionary is the color guard. Instead of the invasive colorectal examination, uh, now people can do a non-invasive home-based test that can still yield the same high positivity result. So education, we know there's nowhere we go to now that we don't see public address system. I mean, public address, where they are constantly advocating for education, health education. Almost every time you listen to the radio, there is somebody or some organization that is talking about disease entities, disease entity or another, advocating for prevention and early detection and all of that. So, modern impact and continued legacy. Their contributions shaped modern approaches to disease prevention and public health. We've already talked about that, and I'm sure you see the evidence all around you as you look at the media, the TV, the radio. They are constantly talking about some health screening or another. Pioneering work in early detections and community health education and equitable care. Those are pretty much repetition of what has been talked about earlier. So we will always remember that all these pioneers collectively, although their specialties may vary, but collectively they charted a course for a brighter future for healthcare in America. So, in conclusion, we can say that Black medical pioneers have transformed healthcare through their contributions to prevention. Their legacy continues to promote health equity and improve patient outcomes. By honoring their work, we advance the mission of of preventive medicine for all communities. So, what should we do as a group and individually? This is call to action. We should endeavor to support preventive healthcare initiatives and community outreach. We should promote health education and wellness in underserved communities. We should also advocate for equitable access to healthcare and early interventions. And finally, we should celebrate and continue the legacy of Black medical pioneers. Thank you so much for your attention. And this is where I stop. And Dr. O.
Thank you very much for that robust presentation at last minute. We appreciate you for stepping in. Thank you.
You're very welcome.
Prevention is very important, and Black people have contributed amazingly to medicine. They have not been given the, proper accolade for contribution, and that is why we feel this session is very important. But that being said, thank you again for taking us back to history to see where we plug in as Black people. Today, though, we do have a lot of us who have carried on and are still carrying on the baton and contributing immensely to medicine. We have Dr. Ben Carson, who was the first Black pediatric neurosurgeon, right?
Yes. Yes. Mhm.
He actually performed life-saving, one first of the kind surgery, separating the first conjoint twins, their hearts and stuff like that. Anyways, Dr. Ben Kansen is still very much alive, and we're grateful for that. We have a lot of doctors on the platform. We're going to do something differently tonight that we've never done before. Dr. Jagbe suggested something of the kind, and I'm like, we didn't prepare people, but we want to highlight the doctors that we have on our platform tonight and what they do. And what I would ask is, when I call on you, I ask that please tell us your branch of medicine or even non-medicine. I'm going to call on the medical doctors first. But doctors that are not even medical doctors, please be prepared, because we want you to share with us where you are, what you do, and give us a word of prevention in your field, because that's what Medical Mondays is about. Dr. Jagbe, I'm going to ask you to go first.
Well, thank you so much again, Dr. O, for giving me the opportunity to share on this group, Zoom. Um, I'm primarily a dentist, and I specialize as an oral pathologist. And having practiced oral pathology for 20 something years before going into private practice, I I now do a lot of things that bring about prevention. And one of the things that I seem to champion is the area of maintaining healthy oral environments using cheap or affordable method like baking soda and hydrogen peroxide. If you have not tried that, I will advise that you will do that, because if you do, you will not be complaining about gum infection. You will not be complaining about a lot of things that other people will be complaining about who are not using that technique. So I really don't want to talk too much about that area, but if there are questions later on, I'll be able to expand on it. Thank you.
Thank you. Thank you so much. Yes. And thank you for that point, because if you have questions, you can put them in the chat box for any of our doctors, or you can raise your hand to ask. So I'm going to call on our Papa, Dr. Mike Oye. Kindly unmute, sir. Fantastic.
Hello,
Welcome, sir.
thank you.
Yes, sir.
Dr. Ajagbe, thank you very much for that historical review.
Thank you, sir.
My name is Mike Oye. I am 86 years old, but I think I look 50.
Yes, you do.
Sir. Yes, indeed.
um, I am an agriculturist by profession, but also a natural healer, also by profession. I'm a naturopath. I use herbs and other natural means for treating people. But in naturopathy, we do mainly education, health education. And we have some things we say to people. You are what you eat. You are what you eat. Food should be our medicine, and our medicine should be food. So I do a lot of teaching on nutrition, human nutrition, and I do a lot of research. I'm a taxonomist. I know plants and their properties. So I do a lot of pharmacognosy and pharmacology. I do all types of things to promote health. I exorcise demons. That means I counsel people and cast out demons from their lives. I believe in spiritual occupation of people's lives. And I minister the Holy Spirit to people. So you can see I'm fairly versatile in using all types of positive means to bring health to people. That's what I do. Dr. O, I think I'm
So
okay.
much, sir. Thank you very much for that robust, presentation, sir, of yourself. And we're looking forward to that 2 or 3 session program with you, sir,
Yep.
that will teach us how to really grow our stuff and move forward to further prevention of disease entities like cancer and all of those things, sir. Thank you, sir.
Good.
Appreciate you, sir. So I'm going to call on, I don't know if Dr. Izugu is available now. Dr. Izugu, are you available? Fantastic.
Sure. Yeah.
You have the floor.
Yeah, thank you guys. Sorry to take that call. Ajagbe, thank you, Doctor. Yeah, thank you very much. And again, thanks to our forefathers and mothers that pioneered healthcare. And I appreciate your last slide really emphasizing the call to action, which is more to preventive healthcare and community outreach, education. Now, I'm trained in cardiology, and I'm also trained in critical care. We've worked with patients when they need organ transplant, getting an organ. I was the first to do, coronary left main coronary stent at Hopkins, and I have seen what heart disease do to people. That I have now revealed that the key is to prevent those problems. Prevention to us is affordable by anybody. And we have been so blessed with so much stuff. So if you put the amount of knowledge here and what we can use that knowledge back to many underserved communities to help them, we just with basic education, we can prevent many diseases when it comes to the heart. So that has been my focus now with Heart Disease Prevention and Training Center, and establishing it not only in Nigeria, but different countries. And of course, with group of our Global Association of Benevolent Practitioners to try to reach many places, not only through just education, but also, harnessing their own country insurance and trying to, buy into an HMO in those countries to help those people. And again, I will implore us to work together in doing that because we can help so many people from here. Thank you very much. Thank you.
Thank you so much. I hope nobody missed that fact that our very own brother here, Medical Mondays family, one of our pioneers here, actually was the first. Remember, we're talking about the first. Dr. Ajagbe talked about all those firsts from our generations past. He was the first to do a state-of-the-art left stent.
Left main stent. It was not being done
at the Johns
Amen. Yeah.
I hope you didn't miss that. And patients that I know who have seen him also rave about who he is, his bedside manner, excellent bedside manner, and just, an excellent cardiologist. So thank you.
We give God all the glory. Thank you. Mm-hmm.
We're proud. We're proud of you.
Amen.
So I'm going to call on Dr. Omotosho. Dr. Bola Omotosho. Kindly unmute. Dr. Omotosho, kindly unmute.
Okay. Now you put me on the spot.
Oh, yes. So you take it to the bank. I will. So are we going to see your handsome face?
I'll try my best.
Okay.
Okay.
Fantastic. Didn't I say it? Did you see that face, everybody?
Thank you, man.
So you
Oh,
have the floor.
wow. What do you want me to say?
What you do and what you want us to take home.
Okay.
Your field of medicine and what you want us to take home.
Okay. Let me start from my current position, which, of course, I will give a disclaimer because I know it's been recorded. So whatever I say here, I'm saying it as Bola Motosho, Dr. Bola Motosho. And the reason for that is now I'm with the Mayor Adams administration, which of course is in the news, with everybody knows what's going on in New York City. So I'm a very strong advocate, and I'm one of the Africans here that actually rooted for him, along with several others. And of course, that's why I joined the administration last year, before all this saga um, started. So that brought me into policy. And why did it bring me into policy is primarily because out of the 62 counties in New York State, the Bronx, where I work, where I live, is the worst county with all the health outcomes and all the health indices and health factors. And this is based on the county ranking reports that come out every year. The first time this was published they started in 2009. And from 2009 to date, we have been rated as 62 out of 62. So,
Wow.
yes. So, it's just like whatever challenges you think we have in Nigeria or, well, yeah, I mean, elsewhere, despite all the resources, we're still lagging behind here in the Bronx. So, in order to change the narrative, I come on board last year, and that's the sole responsibility to look at what's working, what's not working, what are the programs that are available, and what can we do differently. Why am I emphasizing on why I'm emphasizing on these? It's because it impacts the way we look at healthcare, not only in this country but across board. Because you have people from all over on this program, and we think that not in America, but we experience everything that is here in the Bronx. So we have high maternal mortality rate, cancer rate is out of the roof, asthma is out of the roof, life expectancy is much lower than all across board. And New York State, talk less of national average, which on the other flip side, we have a program which will have given Bronx some money, about 20 million, which is from the congestion pricing. You also had that in the news from DC. They put a stop on that, a little halt on that, which is part of my responsibility. So what I'm saying here is entirely from me, not as a Department of Health and Mental Hygiene staff. But prior to that, I was with Montefiore for 15 years. Before joining Montefiore, I crossed over from the city hospital, which is Jacobi Medical Center, and extensive work in oncology, research as well, and infectious disease. So that is my background, other than being a very strong community organizer,
Yes.
which landed me in this role. And that's why I've been so passionate about NEPAC and everything else that's in between to look out for our people.
And we need you
Get
to
the
revive
best.
NAPAC very well in New York. But, you
Yes.
know, were you able to identify the problems in the Bronx and, possibly have possible solutions? if given the opportunity, given what is going on?
Yes, I mean, there are several now. I mean, yeah, there are several opportunities, which, of course, I'm talking for myself, not based on based on the data that we have. I'm talking for myself because I have to get permission now to speak to any public gathering. So, but this is family. So I'm not trying to break any rules, but that's why I'm giving the disclosure audit. Yes, there are several opportunities and several been involved with the local government here in the Bronx, in New York City. And I myself ran for city council over a decade ago. And I've been I happens to be the longest serving committee board chair for 16 consecutive years, meaning no interruption, nothing, which allows me to get to be involved with the grassroots. But unfortunately, COVID, whatever it exposed in terms of limitations and the flaws of the challenges that we have in the Bronx, or you want to compare that to the challenges that we had in developing countries, or Nigeria to be specific, or Ghana, Bronx was not any different. The difference is that here in the New York City, we had a high mortality during COVID, and more than 50% of that came from the Bronx.
Wow.
So
I
that's the
didn't know that.
unfortunate part of it. Yes.
Wow. That's a
So yes, we identify what needs to be done, and that's why I took up this position and responsibility to say, well, okay, let's see how we're going to be able to change that narrative. Next month, this time next month, the national ranking nationwide, the reports will be released, to be specific, on the 19th of next month, on 19th of March. So we're expecting, I asked them, I already told them, listen, yes, there is no magic I'm able to provide, but in the process of trying to create these policies, which takes time, it will take about 3 years to see a meaningful movement of the needle.
different.
And yes, so with a lot of things that I learn on this forum, it really helps me to hear from all over and then see what can be done differently and then tweak a lot of things.
You know, that was why I asked the question the way I asked it, that have you identified and think and found possible solutions? Because 1 year is nothing at all. The
Yeah,
1 year you've been there is actually data gathering and
that's correct.
looking for what the problems may be, the challenges, and then you have to have time to now find solutions, and then implementation is another step. Yeah, it's got to take 3 to 4 years, but the book is still being written. We'll see what happens.
Okay.
Dr. Dr.
Then,
Izugu has a question, I think, for you. Dr. Izugu, go ahead.
Yes, thank you so much, Dr. Motasha. Thanks for sharing what you do and your experiences. And many times the things we go through is to help us create a ministry other places. Based on what you have experienced in the Bronx, which again, when you really practice in some neighborhood here, you're gonna find there's no difference between some of this neighborhood and what we have in Africa in many remote areas. Sometimes actually remote areas even do better because they can eat better food. But based on what you have experienced there, how can we use your knowledge in the other countries for preventive services? Is this something we can talk offline and see how can we harness your knowledge of what you have done in that location? Because it's the same. How can we expand it to some other place? And what can we do to help you even in that neighborhood?
wow, thank you. There is a lot that, let me start by requesting for help. Right. There is a lot that you can do to help me. One, in the area of policy, what's informed public health policy-wise is data, right?
yes, we have some of these, we have these data, but the primary problem is that the turnover to actualize the release of the data takes a while. That's what I found out. That yes, we are talking about 2021 data in 2025. I mean, give me a break. We are in United States, right? So if I have an independent statistician, for instance, that is able to assist and say, hey, this is the data, or I bring you on the coalition, which includes all the big hospitals here in the Bronx, Montefiore, which is headed by Dr. Osua, St. Barnabas, and other CBOs. The major CBOs and faith-based are the Catholic charities, which have a huge network, right? They're under my purview. But if I bring someone like you and say, hey, you know what, this data, which is what we have, but you, in your experience and analysis, this is a big problem and you need to, they will run with it. And of course, I still have to go through the democratic process, but my role is not that of trying to impose on them, but to facilitate what they've been doing. Before I took up this responsibility, they've been in existence for a decade, since 2014, which involves everybody, but nothing had actually moved. So what I did when I came on board is to change the narrative. Instead of all these, you have workshop, you have seminar, everybody comes in, they eat, they go, and they talk, nothing happens. I said, look, you are successful in all the various programs, whether it's cancer screening that you all do. However, it's not impacting the common man or the grassroots. So now let's look at policy that you have the bandwidth for, and everybody now agrees. So middle of last year, after I spent 6 months gathering data, seeing what is going on, because if you are not at the table, you are at the menu. I thought I was seeing it right from outside, being in the grassroots, but I realized, oh, bureaucracy is a different ball game. So they now agree that yes, that is true. Instead of waiting for the Department of Health to create a narrative, now this coalition can jump the hoops and go straight to federal, go to state, and go to city hall to effect the changes that will impact on everyone. So that's the help that I need, that I can easily call on someone that has the expertise on data. Please, can you analyze this report or this survey that they do? I mean, I came from a background of doing clinical study, phase 1, phase 2, which are very intense. But their own survey is like bread and butter that you now think that what's going on? You can't even come up with your analysis. Then it takes 1 or 2 years. And it's because it has to go through different steps from assistant commissioner to this to that before it's now released. So
Thank you.
that's what I need help for. And my own expertise can go a long way to support this group. I mean, and why does that come in? There was a package report, something that I implemented a couple of years back, which I brought into the picture now with them. It's and that of course exists in my hometown as we speak. Just identifying 3 diabetes, hypertension, and cholesterol. Once a month, clinic under first floor of my father's house, and they come in, get some donation free meds. Once a month, they have somebody coming in from another town, the nurse, to give them the free meds, and that helped a lot, a lot. Then the medical mission now comes up later on, and do a lot of other things, but that's a monthly thing that is going on. But I'm not the primary owner of that project. I learned that idea from another doctor here in New York City, and of course I'll give him credit, and that's Dr. Fami Lucy, who also instituted similar thing, who actually started similar thing in his village, right? So now with this role, I now realize that, oh yeah, In the Bronx, you only have two major chronic disease, whatever that you're handling, which is asthma and, diabetes and asthma. And I'm saying, yeah, we have congestion in the Bronx, but you need to bring the top component in so that we can at least see longevity and other things with cancer screening and taking one baby step at a time. So that's where we are.
Beautiful. Thank you so much. Thank you. We'll talk offline.
Thank you so much. Yes, please.
Sure.
I'll connect both of you.
Thank you.
So before I go to the next doctor, thank you so much, Dr. Omotosho. And things will fall in the right places. They will.
Okay.
They will.
Thank you.
Thank you. So before I bring on the next doctor, my sister Celine asked a question for you, Dr. Ajagbe. What is the measurement for the baking soda and hydrogen peroxide?
Okay. There's really no hard and fast rule about the measurement, but it's best for you to not use much more than you need. What I do, maybe that can be of help to you, is take maybe 1/4 of a tablespoon, 1/4 of a teaspoon of baking soda each time. Make sure it's fresh. Fresh one, not the one that you've used and left over from another time in reference. Just take fresh one from the box, which you keep inside an airtight space, whether it's in a bottle or in a Ziploc bag, because baking soda absorbs moisture from the atmosphere. So you don't want to keep it exposed and be using it after it's already been um, saturated with moisture from the atmosphere. So take like 1/4 of a spoon or a teaspoon of baking soda each time. Wet your toothbrush and pick it up. Whether you put it in a container or you put it in your hand, that's all you want to do, to brush first. After brushing with that, then you can use maybe half a cup of peroxide to rinse. uh, it doesn't matter how much you use anyway, because once it gets into your mouth with baking soda being there, or even without baking soda, it will foam. Exposure of hydrogen peroxide to body fluid will make it foam. So, whether it is blood, saliva, or body, any other body fluid, it's organic, and the hydrogen peroxide will release oxygen, which is what it does with anaerobic microorganisms or bacteria when it's used upon them. And that's the reason you are using that combination to clean your mouth. So I don't know whether that helps. Um, I don't think you want to use too much of any of them, because too much of anything is bad.
Okay. Thank you very much.
Can I ask a follow-up question, please?
Yes, go ahead, Dr. Motosho. Go ahead.
Okay. Yeah. Dr. Ajagbe,
Mm.
full disclosure again, since you started this and you mentioned it last year, I've been using it. And there is nothing to hide about it. I found out that now my breath it's been very nice. But you recommended 0.6%
Nope.
of hydrogen peroxide. That
No,
was
No.
back then. But
No.
it's only
No.
0.3 that is out there.
no,
No. Never
0.3.
said no.
Is it?
It's okay, Dr. Motosho, sorry. It was never 6%.
No,
It's
zero
not even
point 0.6.
0.6. No, it's
Is
not
it point?
0.6. Dr. Motosho, listen to me. It is not 0.6 or 0.3. It is 3% or 6%.
Sorry, 3%. Thank you.
3% or 6%. I insisted that we should buy the 3%, not the 6%. That if you happen to have 6% hydrogen peroxide, that you should dilute it 50-50. So you will end up with 3%. If you use the same amount of peroxide as the same as the amount of water mixed together, it will dilute it to 3%. That was my recommendation to those who heard me.
Yeah.
Thank you. I've been
3%
looking
is
for
good.
6%, and
No,
I never saw
No,
it. So
don't look for 6%.
you have the right one. You have the
You
right
have the
one.
right one.
3%.
Actually, with the 6% was mentioned because I knew some people were raising the issue that it burns your gums and this and that. I said no, not the 3%. The 3% will not burn the gums, but 6% would.
So, Dr. Ajagbe, I still have some questions and I have some doctors to go through. And the
Sure,
questions are for you.
no
Um,
problem. Mhm.
is baking soda destructive to dentures or crowns? And is the hydrogen peroxide corrosive to crowns and dentures?
No,
Thank you. Sister Matilda, no, they are safe in all instances. So,
it's actually sorry, Dr. O. It's
yeah,
actually your best friend if you have denture. Because if you think just by scrubbing your denture it will not smell, it's because you don't know the material used for making dentures. So the material used for making dentures is acrylic. Acrylic is very porous. And the porosity, no matter how shiny, when we polish it, the fitting surface where it fits over the gums or the roof of the mouth is porous. And for many people, the holes the holes are reservoir for not just bacteria, but for yeast infection. So the denture will smell after a while, will be smelling even after washing, not because you didn't wash, but because of the cesspool of bacteria and fungus that is in there that is going to cause it to be like that. So my suggestion is once in a while, just soak it in your peroxide solution, and you will see the difference will be very clear. For those who are still, sitting on the fence regarding using baking soda and peroxide, all you need to do is just try it for 1 or 2 weeks and see the difference for yourself. And then you decide whether it is appropriate to use it if you get good result, or you continue to do whatever you think you want to do with your toothpaste and all the other devices available to you.
thank you so much, Dr. Jagwe. One more question, and there may be others, I don't know. Sister Celine said, does that pertain to mouth guards as well?
Yes. A mouth guard also is some kind of plastic. Different types of plastic are being used, in dentistry. Not all of them are the same. So mouth guards are this, they also have some porosity that can also harbor bacteria and fungus.
Okay, thank you. So, Dr. Motosha, as a follow-up, do you still need mouthwash?
No, I will repeat it again and again. If you are using any mouthwash, whether it's prescribed or the over-the-counter one, that is antibacterial. If you do, you are going to kill both good and bad bacteria in your mouth, and the reduction of the good bacteria will cause your blood pressure to rise. The problem with that is when you kill the good bacteria that we call the healthy bacteria of the mouth, um, they have the enzymes to convert the nitrate in your protein to nitric oxide via the nitrite pathway. When the nitric oxide is reduced because you have killed the healthy bacteria, the blood pressure goes up automatically. Because the nitric oxide is what causes the blood pressure to be controlled because of the effect on the very small blood vessels. So don't use mouthwash anymore if you know it's because of breath that you use mouthwash. Use the baking soda to brush your tongue. You can brush it as many times as you want, but once you brush it and you remove most of the leftover food from your tongue and you use peroxide, as long as the peroxide foams in your mouth. If it doesn't foam, that means the peroxide is already flat. If it foams, then you know that it's actually releasing oxygen. The anaerobic organisms that hate oxygen are the ones that create the bad breath in your mouth. So if you can immobilize them by using the peroxide and neutralizing the acidity of your mouth, you will not have bad breath.
Okay. So I have one more for you. Can the combo of hydrogen peroxide and the baking soda kill and heal already existing cavities?
No, it will not heal the cavity, but it will prevent the cavity from smelling like latrine. For those who know what latrine smells like, you understand what I'm saying. Anybody who has cavity in their mouth, the decay that we call cavity smells just like sewer. So the best thing is when you use baking soda and hydrogen peroxide, you clean the inside of that tooth. You will have less toothache, but it will not heal it. Because anytime you already have loss of tooth structure, you're using baking soda or any other material for that matter will not build the tooth back up.
Okay. Thank you very much. I'm going to call on Dr. Booker. Kindly unmute. Thank
Hello.
you. It's
Hello.
your turn. Yes, sis.
Hello. Good evening. I thank Dr. O for this for my Monday evening tete-a-tete. And thanks to Dr. Ajagbe and everybody who contributes on the forum. And our good old doctor who gives us all the herbs. I really enjoy him. I am an anesthesiologist by profession, even though I'm retired. And right now I do much more medical missions. But I just want to let people know that, when our folks come in for anesthesia and they get after surgery, they resist getting pain medication because they think they're going to be addicted. I just want people to know that you're not going to be addicted. If there's pain, take the pain medicine and don't act like you're so strong. The other thing too is just know your allergies when you come in, because some people just don't say, they're just scared to say, to give their history. But it's very important for us to know what you're allergic to, just in case. For instance, if you're allergic, let me bring it out clearly. If you have a problem with eggs, whether you like it or not, tell the anesthesiologist you have a problem with eggs. Because I was arguing with my nephew last week. He said, "Oh, well, I think I'm an allergic, but I don't like it." So I said, "But I don't know if I have to tell them." I said, "Just tell them." Because propofol has lecithin, which goes with the egg white. But we don't know if you're allergic to white or the yellow part. And those are the things that I want people to know. Just give your history, because and don't hide anything. Just tell them what is wrong with you, and we would work with you. And if anybody has any questions to ask about anesthesia, I'll be happy to answer, even though I've left the field about 8 years ago, full time. Mm-hmm. Thank you. Thank you, my sister,
we
for
know you're
calling on me.
we know you're enjoying retirement, but you're giving back because you still keep going back to different countries to do medical missions. Thank you. We appreciate you. And yes, you've left 8 years ago. Not much has changed.
Oh, quite a bit.
Yeah.
And they don't do they don't work as hard as we did.
I know, right? When we don't sleep 3 nights in a row,
Exactly.
residents don't do that anymore. They have it easy now, which is good. It's okay. Thank you so much. I appreciate you. So if you have any questions, please raise your hand or put it in your in the chat box anytime. So I'm going to call on Dr. Ethel Isiano Mitchell.
Hello, Dr. O.
Welcome.
Thank you. Finally showing my face.
Yes.
I'd like to thank you, first of all, for such a great platform. I have a lot of people always give me feedback, and the knowledge is important. For Dr. Ajagbe, who also was my former faculty at Howard Dental. Thank you, Dr. Ajagbe, make my life easy on Dr. O. I don't have to do any work. You do it for me all. My name is Dr. Ethel Isiano Mitchell. I'm a general dentist who also did advanced residency at Howard. Dr. Ajagbe and I were both at Howard in the 90s. My main focus on general dentistry and cosmetic is really holistic. Patient care to me has to be the overall person. When they walk in the office, my private office in Lancaster I had for 23 years, was the human being, and let me focus on their psychological, their spiritual, emotional, physical, and mental well-being. By doing that, I owned a lot of learning. I had to get comfortable with medicine, so I had privileges at the hospital for like 13 years. That showed me the biggest problem my patients were honest was fear of dentistry. It's not that they couldn't afford it, but they had bad experience or never went. So my biggest passion was to anesthetize the patient and they would not even know I did it. And the first thing they'll say is, when is it? Let me know. I'm like, remember when I was shaking your cheek and telling you I'm about to, and I was distracting you? We're done. That had children who were normally fearful for OR to be in the office. I didn't have to send anybody to the OR, and I did not like to medicate. I've been blessed that my background is my family of pharmacy. So we have mini dental, medical, and pharmacy at home. The last part I want to share is my own passion. 2 years ago, I went back home to Ghana. I'm from Ghana. And I challenged myself and I got a Ghana dental license. I really wanted to be my media doctor. Oh, she knows already. I'm big on missions. I'm big on academia. I taught at Temple and UPenn. But one thing that I really want to see is seeing excellent oral health with medical intervention helping developing our continent and any part of the world that need it. And by that, I was fortunate to become a fellow of International College of Dentistry 2023. This gives me the platform where Dr. O now, I can follow her wherever she wants to go and have fun. I really love dentistry, but I had to stop. It was a lot on my hand. And I challenged myself to add a life and health professional license to my degree. So I'm a mother of 2. So pediatrics are a fun part of my life, and I love the elderly. And finally, my special needs. I love my patients that nobody wants to work with, and they work in my office, and we can communicate nonverbal. And 10 years, 20, 12 years, 13, 14 years, the little 5-year-old is almost 20. To me, my practice was God sent. So whatever I did was for my patients. For now, I'm always open to learn and also to teach. That's my take on dentistry. It's fun for me and it's a passion. I never went to work for almost 30 years. Thank you.
Fantastic. Thank you so much. Wow.
Welcome.
Yeah. You never went to work because you love it.
I love dentistry. Yeah, it was a passion.
Thank you. So I'm going to call on Dr. Melody Okperi Ruisi. I know you'll be shocked I'm calling on him. Putting him on the spot. Dr. Melody, kindly unmute. Okay, I'm going to come back to him. Dr. Moses Oduyebo, kindly unmute. Dr. Moses Oduyebo. I can't believe these doctors are shy. Can you imagine? Dr. Oduyebo, unmute. You guys are not off the hook. Very good. He unmuted. So he's not shy after all. Yeah.
Good evening. How are you?
Good evening. Welcome, welcome.
Very wonderful presentation by Dr. Ajagbe. I've been following, and I truly, truly appreciate the wealth of wisdom that he has presented this message to us. Like people that spoke ahead of me, I truly appreciate knowledge when it comes to medical. And when we are listening to this, we are fully encouraged to invite others. Thank you for what you do.
Tell us about you, what you do. What
I'm a
doctor
psychotherapist.
You Psych D.
Yes, ma'am.
Okay, tell us what you do and give us a parting word on what we need to learn to better ourselves from what you do.
Oh, mental health is here to stay. Let's put it that way, first of all. And the chronicity of the symptoms that we are experiencing these days ask us to, and actually begs us to do more and to get more people exposed to the knowledge and the understanding of why we need a therapist in our corner. I always tell people, I say, even therapists need therapists.
Mm-hmm.
So nobody's immune, especially let's look at what's going on recently. Nobody ever knew that federal employees are just going to be laid off just like that.
Mm-hmm.
Nobody had money put aside or $1 million put aside anywhere. So I know that in the next 2 months, we'll be hearing about suicide.
Mm-hmm.
So, and that is what everybody goes to when they are unable to manage the frustration that comes with all of these new developments. So my prayer is that we all keep focus and pay attention to our surroundings. And if you see any symptoms, please direct them to the right channel so that we don't lose any one of our citizens to this upheaval that's going on in the community. The community is already currently charged, and everybody is looking for what's next. So as a mental health clinician, my goal is to continue to educate as many people as I can find.
Yeah.
And hopefully I have enough time. My workload is overwhelming, by the way. Thank you all. Enjoy the rest of the evening.
Thank you. You do a great job, and thank you so much. Thank you for all you do in the mental health arena and all those children you take care of. Thank you.
Thanks so much.
Dr. Melody, unmute, please.
Hello.
How are you, Doc?
I'm fine. Good evening. Sorry, doctor. My hands are still on glove. I was far from my phone.
I know.
I was just using my Bluetooth, but I just have to step aside to do something. So,
I see you are gloved. I see you are working.
Yeah, I'm still on gloves. We're trying to just wrap up the clinic today. Okay, so I'm glad to be here once again. Medical Monday has been an avenue where we learn so many things and we've gained a lot, and most of my people has also benefited from this program. I'm carrying 2 caps as a medical doctor and also as a pastor. Currently, I work in an urgent clinic. We are still here now trying to wrap up the activities for the day. But basically, I'm very, very much interested in community outreach, trying to organize health fair, health talk, seminars for my congregants, talking to my people, African people, Nigerian people, encouraging my people. Preventive medical care is part of what we do, and pastoral work is much of what we do as well. I think that's what I can say now, Dr. O.
Thank you so much. You are awesome.
Yes,
thank you.
Yes, ma'am.
Appreciate you. Thank
yes,
you.
ma'am.
Thank you for all you do.
All right, ma'am.
Doctor, I'm
Yes,
going to
so
call on Dr. Akitonde. Dr. Akitonde, kindly unmute.
Hello, Dr. O.
Hello.
How are you?
I'm doing well. How are you?
I'm sorry, I know I joined late. I'm actually at the gym.
Okay.
What do you want us to talk about? I'm sorry.
Just, we've talked about the Black people contribution to medicine, through the ages. Dr. Ajagbe did a fantastic job. So we're now calling on our doctors now. What do you do? And
okay.
what can you leave with us to help us? Anything you can live with us to help us to impact our health positively.
Okay. Okay. Good evening, everyone.
Good evening.
I would like to say a big thank you to Dr. Ajagbe all the time and every other contributors talking to us about oral health and generally about our health. What I do for a living, I tend to carry a lot of ads. I am a scholarly doctor. I'm a nursing professor, and I'm also a strong pediatrics practitioner. What else you want me to talk about? I've been in academia for over 25 years in this country. I've had the opportunity to mentor nursing students, graduate and undergraduate students, and it's one of my joy to see them coming out, doing very well in their careers. And now my focus of interest will be more into preventive health generally. I had a chance to be involved in a couple of research. The question I keep asking was, what actually happened? I mean, we could see a lot of data on hypertension, diabetes, cholesterol levels being high, but I think we have less preventive program all over, and this is all of us. So if I can use this forum, Dr. O, to appeal, and this is to everybody in your small communities, I know it will be tough, but it can start from all of us. At some of our parties, if we can advocate more for fruits and veggies, I think it will go a long way. And also for all the doctors on the line, I'm begging, we do not have enough data for majority of us in this country. A lot of people have talked about, yes, we came from another country. We have lived here for over 40 years. That has impacted our health, but we do not have data in terms of connecting the health problems together on us. So that is something I know within the United States, to all, I'll say Nigerian Americans, if that's what they want to call us now, that I think we are missing. So, but preventive health and community health is one of my strong passion. And I enjoy knowledge as well, sharing knowledge as well. Thank you. I hope I said enough, Dr. O.
Thank you so much. That was awesome.
Thank you so much.
Let's connect out of here. You just raised an important point, and I think we can.
When you come back, when you come back.
Getting data on us is important. I'm making a note of that, and I think we can do that. We ought to do that. It's going to be very impactful. Thank you.
Okay. Thank you. Thank you.
Yes. So I'm going to call on my sister Rosemary Ogbebo. Kindly unmute. Our Councillor Rosemary Ogbebo. Kindly unmute. Okay, I'll revert back. I'm going to another councillor, Sister Omira. Kindly unmute. None of you in medicine is escaping me tonight. Even the ones not in medicine are not escaping. Go ahead.
Hi, everyone. I enjoy all the presenters. Every time that I am on this platform, I learn something every Monday, Medical Mondays. And I am a clinical psychotherapist. I've been in the field for probably about 30, 40 years. And like this the sister said, my job it's not like a job. I love working with families. So it's never like I was working. I enjoy working with people, encouraging them to be the best that they can be, and strengthening families and children. It's just been a wonderful experience. And I think that it's very important that we keep the families together. And I'm just happy to hear that everyone is trying to improve the community and strengthening the families. So it's been a blessing for me.
Thank you. Thank you so much. We appreciate you and all you do. Mental health is real, especially amongst our people. So thank you.
Yeah.
So I'm going to call on Pastor Dr. Femi Adegbomire.
Good evening, Dr. O.
Good evening.
Good evening. How are you?
I'm doing well.
To God be the glory. You're always shining every Monday morning, and I'm sure all the time.
Amen. Amen. Glory be to God.
Hallelujah. My contribution tonight might look at elderly contribution. I mean, elderly health living. I think one of the things that we've noticed in my company where we manufacture supplements, we have 4 products right now. We have Prosante, which we have for people who prostrate. We have Menusec, which is for menopause. We have Manali for liver, and we have kidney stone. The only company that has that product right now that will break the products down, break the different 4 or 5 kidney stones down and urine out. And the concern is that a lot of us underestimate the effect of these little things that we hear happen to others, that they won't happen to us. So in Mana Pharmaceuticals, what we're praying and try to talk to our community that we should continuously look after our kidney, look at our different things, and don't underestimate the impact of the chemicals we put in our body and the environment where we're in. And I just, it's a very concerned situation where you hear about this one died, or I saw this one last week, he's gone. And we hear what happened, or prostrate, or this and that. So my advice tonight is that let's be more conscious, especially our elderly ones. Elderly ones in our families, in our community, in our churches, our mosques, in different places, that we continuously advise them to look after themselves. And it's very important. Thank you, ma'am.
Thank you.
Dr. O.
I was talking. I didn't know I was muted. Thank you so
Yeah,
much.
I didn't hear you, so I was about to.
Thank you so much, Pastor Femi, Pastor Dr. Femi. I was talking, I was thanking you. And then please pardon me. I was muted and I didn't realize it.
No problem, ma'am.
I appreciate you. So
thank you. And the pastor, Dr. Aluya, has been very, very vocal among us in this state. It was in my church last two Sundays ago, and he did insist to this when we had the coming together of men and women to celebrate Valentine and talk about healthy living among couples. And so he's very, very, very outspoken. He's there all the time to talk about us. He's my personal doctor. So when I go to him, we talk about it. And so I want to thank you for the opportunity that you bring all these specialists together so we can all share our minds and talk about things that can affect our community in particular. Thank you, ma'am.
Thank you so much, sir. Thank you. So I'm going to call on Dr. David Amara. Dr. Amara?
By the way, Dr. Amara was my classmate in medical school. He's just joining from Nigeria.
It's been on for a while.
Yeah, I said he's joining from Nigeria.
Wow. So it's after 1. Oh my gosh, it's late. Okay, Dr. Amara, when you're able to unmute, we'll bring you on. I'm going to call on Dr. Veronica. I told you I'm descending on those doctors who are on the platform, and because you do amazing to share with us. Thank you, please.
Okay, thank you, Dr. O. Good evening, Dr. O. Good evening, this amazing family, Dr. O Monday's family. It's like when I look and I don't see people, Dr. Webo is not there, I mean, always there, I look at everybody. Thank you. Thank you for the privilege to speak for a moment. I am not a medical doctor, but I feel like one because I'm around all of you. My doctoral is in educational leadership, administration, and policies. And my passion is professorship and working with communities where there's struggles. Basically, what do? I am a professor teaching people who want to become teachers, social sciences, and then those preparing for their dissertation. And then my other life is being the CEO of a nonprofit where I get grants from the state Department of Education and the Department of Social Services, our county, and the city, and any other grant that comes my way, and all to serve the low income families in our community. And one thing I want to highlight, and I bring it up with teachers, is to pay, and of course, this is for parents as well, is to pay attention to bullying. You medical doctors know that bullying, at least that's the data we have, is mental health situation. And it starts from when they're very little. So listen to children, what they say to each other is a mental health struggle for the child. While they try to show I am strong, but there's a lot of struggle, weakness that they're covering. And they enroll other children that have low self-esteem because they have low self-esteem. And so we work a lot with our teachers to work with their families and to work with such children. And I was so happy. I'm one of those that celebrated when they established that it's mental health. So the bully comes like they're strong and they have 10 people behind them. Without those 10 people, they are dead. They melt. And so they need people who stand up to them, and the schools are taking them more seriously. Because that's how you end up with somebody that's just been a victim of it, or that's in it, that one day brings a gun and shoot up people. There's a lot of mental health there. So it starts with you as a parent. What is your child saying to people? How are you teaching them to stand up? How are you teaching them to be respectful? That respect it goes a long way, because lack of respect is a sign of so many troubles. So let's pay attention from when they are young. From when you hear them say not that's what's not right, teach them conflict resolution. There are many bullies on the freeway. They are giving you fingers, they're saying bad words, they can't even understand how to wait and take turns. Those are really signs. And so that God help us with what's happening in our lives now. And let's look out for those that are struggling. Some people look strong, but let's ask, let's check in. People are struggling. Let's check in. Let's talk to our neighbors. Let's talk to that person that lives alone. Let's make sure that they have people they can reach out to close to them. But my emphasis today is bullying, and bullying can happen with young people and older people. But good to know that it's mental health. It has a lot to do with low self-esteem. with all the struggles that they might be going through. And who knows, maybe Dr. O can help us in the future. Let's go back again. We started it at some point to talk about bullying because it's real. It's killing people now. There were 2 children who died in California trying to be strong and to be accepted. And they gave them what they thought was cocaine, but it was fentanyl. And then, so 2 died, 2 are still in hospital struggling for their lives. This is all connected to bullying, because bullying means you want to be strong, you want to be cool. So they give you something to smoke up your nose so you can feel cool. And then, but a child with confidence will say no. My children used to say, "You're not the boss of me," and I say, "Yeah, you tell them you are the boss of you." So you have to teach children, and children that go through my life, well, they say, Doctor V teaches you, you are the boss of you. So you need to be the leader, in every group. Don't let people push you around. Make choices, and let's teach our children how to stand up, because it goes a long way. It can save life. Like these 4 children trying to be cool because of trying to impress others. They lost their life. Parents are crying now. So may God bless our children and bless us all. In Jesus' mighty name I pray. Amen.
Amen. Thank you so much. Yes, I agree. We have to revisit bullying again.
Thank you,
Dr. And I'll be calling on you, please.
I'm happy to join that conversation. Thank you, Dr. O.
It's very important.
Hello, hi, how are you?
Thank you. Okay, looks like somebody needs to be muted. Thank you, Dr. O.
Okay. Thank you. Thank you so much. I'm going to call on Dr. Matilda Charles. Kindly unmute.
Good evening, everyone.
Good evening, sis.
Monday evening is always a pleasurable evening to learn. My doctorate is in divinity. It's an honorary one because I run a ministry for women. And there's a lot that is happening among women. A lot too has been mentioned already. But the reason for chipping in here is to tell all of us about the 7 F's that we can all be mindful of to live well every day. The 7 F's. 1 is faith. The first F is faith. Keep your faith in order. Keep your faith in order. Stay close to your God. And the second F is family. Take care of your family. Keep a good relationship. It all builds up to good health. Finance. Take care of your financial health. It is important. The next F is fitness. Fitness cannot be overemphasized. In our Black community, I don't know if we really pay a whole lot of attention to fitness. Inside fitness, everybody should try and know their numbers, do their annual checks. It is important. Know your numbers. People are walking around, they don't know what their blood pressure is. They don't know what their heart rate is. They don't know their cholesterol level until something happens. And some people don't even know how to dial 911 when something finally happens. Please, let's make sure that we keep fit, we are exercising, we are hydrating, we are eating the right foods at the right time to stay fit. The next F is focus. Pay attention. This is mental and build your time. The Bible says we should use our time circumspectly. We all grow up, we all work around here saying we are multitasking, but I truly believe the brain is actually doing one thing at a particular time. So we need to be mindful of how we divide ourselves so that we don't spread ourselves too thin. And then the other F is fun. We should try and incorporate fun into our lives. Simple things like just sitting back and playing games. There was a time I said I wanted to play a game with my husband, and he just thought it was this is old stuff. It's like anta ludo, anta some, those card games. It's like small things for small kids to do. But fun is important in life. Fun. Fun, whatever gives you fun, whatever makes you happy, do it. Whatever your hobby is, try to incorporate it every week. Do something. Do something that will produce, the happy hormones. Do something fun. And the last F is freedom. It is a blessing to be in a land of the free. So take time and give thanks to the Lord for being free and enjoy every moment of it. And these are the 7 F's I want to leave with all of us. Thank you.
Wow. That was succinct and deep. Thank you. I wonder if you can share it so we can send it out by text, by email, so that, we can have more time to ponder on them. Thank you so much for sharing, Doc. Appreciate you. Thank you. Dr. Mayowa, kindly unmute. Dr. Fawole, I saw you. Yeah, here you are. Thank you.
Well, good evening, everyone.
Good evening.
Dr. It's always good to see you.
Thank you.
Thank God for the grace of God upon your life.
Amen.
And we're grateful for Medical Monday family. So I am a doctor in education, not medical. And I am an educational consultant. I'm also a special education advocate, as well as a professor. My passion is actually in enhancing lives for individuals with disabilities. So besides being an advocate, I have a monthly program that I facilitate to support parents, to educate and inspire parents to be able to better support their children in school. I guess the charge for all of us is that even if we don't have anyone in our immediate family with disabilities, we all know somebody that do need support. And awareness is very important so that we can all relate together and we can have a community that is happy, that is thriving, and where all our children, whether they have a disability or not, they can all achieve their fullest potential. So thank you for the opportunity to share. May God bless all of us.
Amen. Amen. And thank you for always taking that time to educate and to help children. The number of autistic children have risen tremendously. And the time you take to, basically, I would say care these children is commendable, and only God can reward you. Thank you for all you do.
Thank you. Thanks.
Thank you. So if anyone is on the platform who knows somebody who has autistic children or children with needs, please connect with Dr. Fawole and attend these sessions. I have attended. They are life-changing. Definitely life-changing. So thank you so much again. Sister Rosemary Ogwebo, Dr. Francis Alu, if you can unmute, that would be great. If not, that's okay. I'm going to call on Dr. and Dr. Ajay. And it doesn't matter if it's Dr. Ephraim or Dr. Hannah that addresses us. Kindly unmute. Dr. and Dr. Ajay, are you there? Oh my gosh, we have so many shy doctors tonight. So while I'm waiting for any of those three to unmute. If you'd like to share what you do to benefit our society, because you don't have to be a doctor of medicine or a doctor at all. A lot of us, especially on this platform, are doing great things in our communities. And if you want to share, we have a few minutes before we round up tonight for you to share. Okay. If not, I'm going to revert back to Dr. Ajagbe. Dr. Ajagbe, thank you again for an amazing session. If you please give us your parting words, that would be great.
Well, thank you, Dr. O, and everyone that has shared something with us. No knowledge is lost. If we understood what is being shared, I'm sure at some point the information can become very useful, if not for us personally, but for somebody else. I mean, I've listened to the cross section of the information shared, and I can still, very confidently link everything to what happens soon after birth. It may not be easy for everybody to understand where I'm coming from or where I'm going with that, but I can assure you that almost every disease is connected to the mid-facial development, apart from the brain, the kidney, the liver, and all the other organs. But if there is a problem with the mid-face, the middle of your face, which means the face is divided into three from the top of your head to the chin. You have the upper third, you have the middle third, and then you have the lower third. Most of the diseases that we are facing is associated with problems in the middle third. Middle third because that is where the airway begins. And the airway, once airway is restricted in that area, is downhill for almost every system. Because anyone who cannot breathe through their nose will automatically breathe through their mouth. Everyone who breathes through their mouth, we have problems with their respiratory system. That is, of course, the nose is already affected, the pharynx is already affected, the lungs will be the next one to be affected. Once the lungs is affected, we talk about asthma, we talk about bronchitis, we talk about, COPD, we talk about so many things. Once that is started, the individual will not be able to sleep well. If they can't sleep well, either because they have upper airway restriction and they have enlarged lymph nodes, enlarged tonsils and adenoids, and all of these are going on, it further restricts airway to their body. When they don't get enough oxygen to their system, almost every organ in the body will feel low oxygen tension. So when I say that, I mean it is not because that is my area of concentration. I just know that if the jaws, the upper jaw in particular, is poorly formed, it will affect everywhere in the body. And the commonest precaution or preventive measure that we need to encourage our community to embrace is the aspect of breastfeeding for the newborn. As Dr. V posts the picture of this lovely baby, you can see if that baby is developing very well, the face will be symmetrical. And if the baby is not being breastfed, it's going to affect so many things. No matter how we want to justify why we are not doing breastfeeding. It is not, unless it's medically impossible for the mother to breastfeed. If it's medically impossible for the mother to breastfeed, it's okay. Then at least we know there is a foundational reason why the mother is not able to breastfeed the child. When the baby is breastfed, the upper airway will be developed properly. The mouth will be developed properly. The tongue will be developed properly. And all these structures are what actually make life livable. Because if any of this area is messed up from developmental abnormality, that child's everything goes down. The child will have low self-esteem because, first of all, their teeth will be all crooked and all mangled up because the jaw is not fully formed. And any child that does not have well-formed teeth, even as a baby, the baby teeth, if you see any child, any baby that the teeth are already crowded, that is problem. That means their airway is compromised. And if nobody has told the parents about that, whether it's the pediatrician or the dentist, then it is unfortunate because any child, any baby that has baby teeth, that the teeth are already crowded, that means the jaw is underdeveloped. That child can be helped very early as soon as the child can follow simple instruction. But in the meantime, if it's an infant, if the mother can, increase the breastfeeding, I'm sure the baby will begin to catch up. So, for Dr. Motosho, I'm sure you're saying that so many cases of asthma in the Bronx, and diabetes and asthma, all of this in the literature have been tied to airway restriction. They've been tied to even, anything that causes obstructive sleep apnea will eventually lead to all of these chronic diseases that all these specialists are taking care of. So, when we are gathering data, because I've been hearing everybody needs data, and we know that's very important. We saw the importance of data in terms of managing disparities across board. So data is very important. I can assure everyone on this platform that if we begin to focus on the mid section of the face and look at what is going on there, we might be able to see a lot of connections. When Dr. V was talking about bullies, most bullies are very unattractive. I mean, in many ways. And it's because of the unattractiveness that is making them to have low self-esteem. And many times, if you look at them, they don't smile. Why don't they smile? Because their mouth doesn't look good. Not only that, many of them are mouth breathers. And many of them have all kinds of chronic diseases because if they are mouth breathers, everything goes downhill. So I just want to say that when we are addressing many of the issues that we have for patients or individuals that we know, let's look at their mouth first. As they talk, their mannerism, you begin to see that there are issues that need to be addressed. And once their aesthetics are improved, many of them just change. Aesthetics in this sense is growing the jaw. If we can expand the jaw for them, the teeth will begin to line up in their rightful places. The upper airway restriction will be opened up. They can breathe properly. The nitric oxide that they need to be in the air that they inhale will be ample and be sufficient to keep the lungs open. Because when the lungs doesn't get nitric oxide that is supposed to come with the air that is coming into the lung is trying to shut down. So most of these things, I'm not trying to overemphasize any of these areas, but I think it's important that we see that most of the problems that we are talking about are connected to the mid phase. And if the mid phase can be treated very carefully and the patients can, the individuals can breathe properly, they can eat properly, they don't have lung issues that could arise from either aspiration from the mouth or because the airway is blocked around the nose and the sinuses and the pharynx, then the individual will have good health. So I'll be glad to discuss with any of the specialties, whether it is education or medical practitioners or nurse practitioners, if there's any way we can truly collaborate in trying to help a lot of the people. Currently, I sent an unsolicited, proposal to the city of DC. I'm sure they are still toying with it. They have not given me any feedback. I'm expecting an excellent outcome. I called it Breathe Well DC. That Breathe Well DC is a proposal to bring to the forefront the problem of the mid phase that shows that many of the children that are incarcerated early, that are called juvenile delinquents, that are labeled as ADHD, have problems with their mid phase. And many times, when you link it with the way their parents raised them up, most of the mothers never breastfed them. And many of them were on pacifiers for a long time, which never encourages development of the upper jaw as well as the tongue. Many of these babies or many of these individuals have tongue tie, they have narrow, deep roof of the mouth, which we call palate. They have blocked nose all the time. And most of the time, they breathe through their mouth. So if we can address this from an airway-centric approach, I'm sure these children they will become very successful, contributing adults. And I'm very confident about this approach, and I'm hoping that the city of DC will take a look at it and will be able to help many of the children that have just been sent to detention just because they cannot cope because of their cosmetic appearance. And they become bullies, they become problem children, truants. They don't go to anything that is supposed to build them up because they are ashamed of what they look like. Thank you for letting me share. I hope this will be one way to bring about prevention of many more things that cost taxpayers a lot of money.
Thank
The
you.
proposal I gave will actually, if they follow through it, will actually save the city of DC close to about $20 million a year.
Thank you
If
so
they
much.
will
Thank you
look
for
at it,
doing that. Thank you.
if they will look at it, it will save the taxpayers about $20 million a year. I mean, but of course, I leave that to the policymakers like Dr. Motosho's counterpart in DC to take a look at stuff like that.
So, till
Thank
we
you
meet
so much.
next week, I want to say please keep safe because, we still have all these viruses looming around. You wonder why I say this all week because it's what I see. And we look forward to a vibrant time next week. Dr. Aluya said he would make it next week. We'll hope to see him then. And please keep safe. I love you all. Oh, by the way,